let's talk about something that drives a lot of people crazy. Why American healthcare costs so much. Seriously, it's a puzzle people have been obsessed with for decades. Today, we're going to dig into the data and unpack the real and honestly pretty surprising reason the US is such a wild outlier.
You've probably seen a chart that looks something like this. It's showing what slice of a country's entire economy is spent on healthcare. And, you see Germany, France, Japan, Canada, they're all kind of hanging out in the same neighborhood. And then you see the United States. Whoa, we're not just a little bit more expensive, we are in a completely different league. This one chart right here is the key to this whole mystery. Now, what's so fascinating is how that chart seems to fly in the face of a core American belief. I mean, we hear it all the time, right? Government is slow, it's bloated, it's inefficient. If you want something done right, you give it to the private sector. But if that's true, then why does the country with the most privatized healthcare system have, by far, the most expensive one in the entire world? It doesn't add up. And that question leads us right to the heart of this whole thing. We're about to break down that first chart, and I promise you there's a twist in there that might just change the way you think about this entire problem. Okay, here it is. This is where the story gets wild. We've taken that same total spending and split it in two. The blue part is public, government spending, and the red is private spending. Now just look at the blue parts for a second. The amount of public money the US government spends on things like Medicare and Medicaid, it's about the same as these other countries. The entire reason our bar is so ridiculously tall comes from just one place, that enormous red block of private system costs. So let's be super clear about this. The problem isn't that healthcare in America is expensive. It's that the private insurance system, specifically, is what's driving these costs into the stratosphere. That's the real anomaly we need to figure out. All right, so if we know the private system is the issue, the next question is why? A really common argument is that, well, Americans just use more healthcare. We get more tests, more procedures, we're just consuming more. But is that actually true? Let's take a look. As it turns out, nope, that theory is a total myth. The data shows Americans actually go to the doctor less often than people in Germany or Japan, and the number of times we're discharged from a hospital is pretty similar to other countries. So we can just throw that theory right out the window. We are not paying more because we're using more. The real difference is much simpler, and frankly, a lot more frustrating. We just pay higher prices for everything. I mean, from a simple checkup to a complex surgery to a single pill, the sticker price for pretty much everything in the US is just wildly inflated compared to anywhere else. And get this, the price isn't even consistent within the US. This is just mind-boggling. This slide shows that the price for the exact same ER visit at the exact same hospital can change dramatically depending on who's footing the bill. And notice who gets the best deal? Medicare, the government program. And who pays the most? The uninsured, who can get charged up to 4 times more for the same service. So why? Why does the government get a better deal? Well, it all boils down to one simple concept: negotiating power. Or more specifically, the power to look at a price and say, nope, not paying that. Let's break down how that one little difference creates two totally different worlds. So on the left, you've got the US system. It's chaotic. You have hundreds of different private insurance companies, and each one is out there trying to negotiate prices on its own. Their power is totally fragmented. But on the right, you have the model used pretty much everywhere else. One central body, usually the government, negotiates prices for the entire population. All their power is consolidated into one massive force. I mean, think about it. When you represent all 65 million people in the UK or all 38 million in Canada, you can go to a big drug company or hospital and basically make them an offer they can't refuse. Because if that company says no to your price, they risk getting locked out of the entire country's market. That is some serious bargaining power. The whole American idea is that we're supposed to be consumers who shop around for the best deal. But that model just completely falls apart with healthcare. I mean, come on. When you're unconscious in an ambulance, you're not in a position to negotiate. When you're scared and in pain, you don't have the leverage to say no. In other systems, the government has the power to say no for you. Okay, so if the problem is sky-high prices and the solution seems to be this consolidated negotiating power, then why is this so insanely hard to fix in the United States? Well, the answer is kind of baked into the very system we've created. It's created this powerful, self-sustaining loop.
The high prices we all pay lead to massive profits for insurance companies, drug companies, you name it. That money then gets turned into immense political power through lobbying and campaign donations. And what is that power used for? To block any and all reforms that would actually lower prices and, threaten those profits. And this right here is the great irony of American healthcare. The system has become so incredibly expensive that it's now incredibly difficult to make it any cheaper. Because what you and I might call waste or inefficiency is also somebody's salary. It's a hospital's revenue stream. It's an entire industry's profit margin. So does that mean we're just stuck? That it's hopeless? Well, not necessarily. The source material we're looking at suggests that the path forward doesn't have to be some massive all-or-nothing leap. And this is really the good news here. It doesn't have to be this big, scary, all-or-nothing choice. We don't have to burn the whole system down overnight. Instead, we can think about taking smaller, smarter steps to start consolidating that negotiating power and bringing costs back down to earth. For example, one idea is to build on what we already have with Medicare. It's already the biggest single negotiator in the entire country. So this plan would expand Medicare's benefits, automatically sign up every kid in the country, and create a public option for most adults to buy into if they want. A move like that would dramatically increase the size of the negotiating pool, giving it way more power to drive down prices for everyone.
And that brings us right back to the question that kicked this whole thing off. The data we've walked through today really suggests that despite everything we're told, healthcare might just be one of those unique things where a public, consolidated system isn't just an alternative, it might actually be cheaper and better. What do you think?